Step by step, we'll light the way.
Hello, Dr. Lemmo. Good afternoon.
Hello, James.
Oh, wonderful. And it was good timing on the subject today regarding glioblastoma. I was speaking with a patient who has glioblastoma, and you were talking about like post-treatment or
Yeah,
lack thereof.
yeah, so I think, when people get a diagnosis of, say, brain cancers, like glioblastoma is a very common malignant brain cancer. And it seems like when, say, if a patient is, maybe they're operable to some degree and they operate and then typically what's used is chemotherapy, radiation is used in combination, and then maybe some chemo maintenance.
Hmm.
And these poor people are kind of like, you can see like some of the impacts of this, they might be not thinking as quick as they used to be.
Right.
Maybe they're not able to socialize as good as they used to be. And they're kind of just left alone. And what I've learned throughout the years is that, like, when you look at, say, another example, like, we hear about concussions, right?
Right.
So and we hear about these athletes when, they get banged on their head. All of a sudden it's like, oh, let's pause, let's rehabilitate them. Well, let's do all these kinds of approaches. Let's change their environment so they don't get too much noise or too much light or too much whatever, right?
Right.
And that's from like banging their head, right? Then you have these poor people with brain cancers where they get their skull cracked open, they get,
Right.
then they radiate it, they burn it, then they maybe throw some chemo into the mix, right? And then they're basically told, okay, I'll see you in for next treatment or whatever. It's like, and that's it. They're left alone.
It doesn't sound very nice.
Yeah, and I feel it's like an important gap that's totally not acknowledged. And I'm not just talking here. I think it's just globally. It's a
Right.
global phenomenon. Like I remember I've been like I'm also treating this younger child with a history of a brain cancer. And then we were talking about this. He had a brain surgery. He's slowly recovering. And I go, is there any sort of rehabilitation being discussed with you, any kind of thing like, and they said no, you know,
Hmm.
um, and yet, like I remember my daughter, she banged her head several years ago and she had a concussion. It's like we saw the specialist concussion doctor. They go, okay, we can incorporate. They gave her like techniques in terms of, okay, not too
Right.
much noise, not too much light, when you're studying, like take it easy. Also like, hey, there's physiotherapists, there's there's all these things you could do, right?
Right.
And this is being recommended. There's even talk of hyperbaric oxygen, and yet here these poor people with brain cancers who really go through some life changing, altering experiences, and they're just none of that is being at all being discussed or at all being addressed.
I Googled it just because the subject came up, and I didn't find any much of anything really. And I'm like, I no wonder I'm not hearing anything about it. Nothing is really being recommended.
No. And I think this is like an area where, I think that the very things that sometimes are suggested to try to, rehabilitate people. So I always tell people, like, I go, when you've been having this, it's like having a concussion on steroids.
Right.
That's what I tell people. And so one of the things you should be focusing on is what could we all do, or building a team to try to rehabilitate and get you back to some state of normalcy,
Right.
and then the great things are is that these things as well could even spill over into like, oh, maybe it could be useful for fighting brain cancer too,
Right.
and so it there's all this crossover, right? And but it's exactly what you found in your research. There's like nothing out there that I have seen, and we deal with patients all over the world, and I don't see it at all like emphasized in any kind of country. Now, obviously, like, when you're looking at, say, a surgeon, for example, and say a neurosurgeon or who deals with brain cancers, they're just too busy focusing on their thing,
Right.
And then you might have, if they're doing radiation, you got a doc focused on that and doing their thing, and
Right.
so
Like
they're
somebody,
really,
it's like the can just keeps getting kicked further down the road. Somebody's eventually going to deal with it, but it's not it.
it's not the system, you know what I
Right.
mean? Like it's not, so there isn't like, say, and from what I've seen up to this point, there isn't such thing as a person or team that specialize in this. And this is where I think the integrative, medical community, the naturopathic medical community, etc., really has a lot of value in this area to, while people can debate, well, I'm doing this for fighting cancer or helping with reoccurrence risk or whatever, I
Right.
go, hey, a whole other side is as well is what could we do to try to get you back to somewhat more of a normal functioning state,
Correct.
it's instead of people being told, well, this is your new normal,
Yeah. No.
you know?
I want to I want to get on a different ride. Right. So
Yeah.
the when I would assume that it would be best for a patient. Let's say they're deciding to do integrative, both uh, standard of care and an integrative basis. When, I would assume that it would be best that they're getting in contact with you prior to the surgery, even to start setting up later treatment protocols. Is that correct?
Yeah, like I think what's what we've discussed in other episodes, that the sooner the better, right? Like
Right.
it so, this waiting and seeing and just seeing what time would do or whatever is that's not been my observation, right? So it's like if like obviously when some people are diagnosed with, say, a brain cancer, for example, it's there's no like it usually it's a lot of the times it's in an emergency setting, right?
Right.
So it's they had a seizure or something happened, and then they're like, oh, looks like this is what we found. We have to
Right.
get this addressed, right? So I think whenever there's like time, knowing that there's like these further procedures and standards of care that are approaching, it's like, yeah, the sooner the better. And so, and instead of maybe thinking of it of as in some cases, it's like anti-cancer protocol, which it could be fused in there. Another discussion you could be just saying is like, listen, your poor brain and your poor nervous system is has just been insulted. It's going
Right.
to be potentially insulted more. We know that recovery for brain, nervous system things is slow. Talk to anyone who's had a concussion. Like, look at these athletes. You're like, some of them are off for over a year,
Right.
and or longer, or they've tried to come back and they're like, nah, I'm still not right, so I think that the time to incorporate, and just like these athletes, as soon as they get a bump on the head, boy, right away the team is like is
Well,
is on them,
that's why we need that's why they need an integrative team if they're going to be ignored by standard of care and just said, hey, this is your new normal, get used to it. That that's
Yeah.
That's not appropriate, in my opinion.
Oh,
Especially if you're, the shoes on the other foot, you want to get your life back. Right?
that's right.
What are some things that might be discussed on an integrative setting to help them get back, get their life and health back?
How I look at it is like, because all these tools tend to overlap, right? And so So things that could help with like surgical healing, surgical recovery, things that are helping with potential radiation damage, and chemotherapeutic agents, etc. There's a lot of overlap, right? And
Okay.
trying to get people better. So again, back to fundamentals, obviously, like we know about a basic. So obviously making sure that they're trying to be somewhat physically active, get that oxygen flowing in the body and brain.
Okay.
Um, you know, Trying to obviously improve their nutrition, right? So obviously like these great phytochemicals that are found in plants and healthy foods, they really can help to nourish you and your nervous system. Then you can get into trying to get into improve the central nervous system, like more oxygen-based therapies. So, for
Okay.
example, like they're even talking about now like hyperbaric chambers being used in concussion treatment, right? So that
Okay.
oxygen trying to repair the brain. Again, you can't go wrong with that kind of view and windows. Like acupuncture is great. And then like, we're always obviously, incorporating a lot of these injection treatments and intravenous vitamin C and all those treatments and things
Okay.
that support the brain. Like, so when someone say, for example, oh, I hear about mushroom extracts are useful for fighting cancer, and there's, lists of them there, like, turkey tail or reishi or AHCC or etc. Well, I'm going, well, how about the ones that we know have an effect on the nervous system and brain, like lion's mane,
Okay.
And so, and who's to say that those don't have anti-cancer properties as well? Because all these mushrooms tend to overlap. So you're starting to focus on that side of things, that could have a dual purpose role of trying to support their nervous system, like melatonin. You can't go, that gets into the brain and nervous system, and there's talk of it helping with, say, radiation and everything else, and anti-cancer potential, like all that. It's those kinds of overlaps, right? but
Gotcha.
but but also at the same time, like, like that's where you get into some people, they need like better structured, physical exercise rehab kind of interventions, right? And or physiotypes or exercise therapists, and all the above, right? So
Okay.
I always tell people, like, okay, put the brain cancer diagnosis aside, and I just say, if you had a very, very, very bad concussion, what would you do? What are the protocols out there that you would look at, right? What are the
Okay.
protocols that these athletes would look into, right? And that's kind of what you would do, right? And
Okay.
or generally go. So in that world, like, yeah, people are talking, how's about these certain peptides I hear about with the brain and the nervous system? Well, that could be too, right? There's even like metabolically, like there's these ingredients, like say called oxaloacetate, that's shown to help with the mitochondria. And there's even talk of it actually fighting brain cancer as
Wow.
well. And metabolically, it could cross over to potentially helping your brain nervous system, just trying to, like you're fueling it to recalibrate, right?
Okay, great.
Yeah, like, yeah, in the system, all these things are like considered, well, more anecdotal or experimental or whichever. But it's not to say, though, on the flip side, you can't say it's not helping somebody in some way
Right.
as well, right? And so it's that world that you're navigating with. But I think, like things that like get that neuroimmune activated and balance, again, calming that inflammatory response of the brain that's been insulted from surgeries, from potential radiation and other things. You're just trying to kind of like be nice to that. And,
Well, and then often patients that I've spoken with, their surgery, the doctors or the surgeons have told them, "Hey, we didn't get all of it, right?" So uh, now I was reading through some of the side, something common seems to be doing a chemotherapy uh, maintenance pill, right? And for most of us, we're going maintenance. That doesn't sound so bad. And so I go, well, what are the what are the side effects of that, right? And you're like, well, it's a pretty long list, right? I go, that seems a little rough, right? So there's got to be some other options. I mean, even if you're doing that, there's got to be some options to help mitigate, some of these negative side effects. So, and that couldn't possibly be a long-term solution.
Yeah, what you're bringing up, which is very unfortunate, is that in the realm of, say, glioblastoma and other related cancers, is the protocol really hasn't changed much in over 20 years. Like
Hmm,
that's it's one of those category groups. It's called the Stoop protocol, where it's like that chemo pill called temozolomide is
right,
used as standard of care. And even though they might, like, on pathology, say, well, you're this version of glioblastoma and you're this version, or you have this subtype, or you have this unique feature, but yet we're going to treat you all the same.
right.
And so it's really unfortunate and sad. And which is why, and yet being creative to explore other things, still not even encouraged in those groups where we know, like, this has been the protocol for like ever. And
Years
yeah,
ago, I remember having conversations with a
yeah,
patient, and they
yeah,
said, "Yeah, they've got me on TMZ." I
yeah,
didn't know what that was. I mean, it sounds like the TV show, right?
right.
So I'm like, well, that doesn't sound so bad. And then you start looking at it and going, oh, that's not so good, right?
Yeah.
So those are
And
some rough side effects.
I think, and what I suspect is, like, so again, if you are just focusing on, like, getting that brain and nervous system like adjusted, renormalized as best as you can, I bet you know what I think also happens? Their survival could be improved. Because we've
Right.
already seen in other cancers where when you improve quality, you can actually improve their survival.
Excellent.
And so while maybe it hasn't been looked at like in glioblastoma or those kinds of cancers, if you're just kind of like looking over here, looking over there, and you're like, okay, well, over here, why not do we go there? You know what I mean?
Right.
And I think that's what I mean about this category is gets the shaft, I find, and in so many ways. And then on top of it, because we know, for example, with, like, when you look at the statistics of, say, glioblastomas on the whole, there needs to be improvement.
Right.
And so I think that's where, when you're improving people's re-normalizing them back and so they could still be functioning and part of society. So I have these patients of mine with glioblastoma. They're like they become competitive cyclists. You know what I mean? Like,
Excellent.
yeah,
Excellent.
like, and you're kind of going like, and it's like, yeah, they're kind of back, and you can tell, like, the
Mhm.
cognition is not yet 100% to what they were, but like it's pretty damn close, you know what I mean? And and
Right.
and then their quality is so high because, like, they're physically active, so that means that's oxygenating the brain and all those factors, and so there's this amazing kind of like a refortification of that central nervous system is occurring.
Right.
And that's what I mean. So it's like, I think back to this concussion subject, is that if you focus on that part of it alone, like, even put the anti-cancer just aside, I promise you'll be having some level of anti-cancer effect
Right.
as part of that as well.
And
And
when you start seeing improvement, uh, then that that really does something to you, psychologically. When I've talked with patients, they're going, I'm feeling better, and then now all these other aspects of their life seem to be getting better, right? They're showing that signs of improvement, and the quality of life is increasing.
yeah. And then,
Cycling, my goodness.
yeah, I know. And can you imagine, like, you're cycling and you're not
Yeah,
supposed to be so steady? I know.
right, right.
I know. Yeah.
The
So,
the last time I tried getting on a bicycle, I'm like, oh, it's like riding a bicycle. No, it's not. Because if you haven't done it since you were a kid, try getting on one. Yeah, tell me what happens.
Yeah. And then imagine like these people that where they are, like say there are these improvements and that you can help them. Then
Fantastic.
you could be adding on like other approaches and tools that, hey, like this could spill over for fighting cancer. And guess what? Oh, maybe we could move things that direction a bit too. But on the whole, we're also making sure that you're trying to be as best as you can.
Right.
And like anything, these are you always got to customize these things to the person because obviously, there's people that, they've had like impacts on their walking ability and writing
Right.
abilities and speech abilities, right? So it's like you're always customizing these to each patient, but it doesn't mean like you can't try to improve them in some way,
Right.
which then in turn, then, it could improving their central nervous system, hopefully, which in turn could be helping them to like dealing with the brain cancer part of it too. And
Excellent.
so that's the beautiful thing, like, you're talking to the guy, like not to age myself, but when I started practice, you know what they used to say about exercise? They used to say it has nothing to do with cancer. Go figure, right? And they'll never say that again,
Well, that's
but
like walking into the waiting rooms and the doc was smoking. You and I went to school where the teachers smoked in the lounge, right? So the you know yeah,
so
yeah,
so there you go, right? So I think that's what's great, and I really appreciate that you're trying to create awareness on this subject area because it really is a big missing hole in medicine, period, around the world for this area.
that's when you're seeing hope and you're getting your life back, what a the joy that it brings, so that when you've been put into a situation where you're going, hope is diminished, right? And then now you're getting your life back, uh, you know, the just what an improvement that makes on everything, and to become I'm glad that we talked about the cyclist because most of us would love to be able to just get on a bicycle as it is now, let alone after surgery and radiation and chemotherapy.
Yeah,
So there, uh, you know, I want people to get that hope out of these conversations that we're having. Going, hey, it doesn't have to be uh, all of these negative outcomes. That doesn't have to be you. You could be one of those positive outcomes,
that's right.
right? And there are a lot, and it's not just a small amount of stories that where people are getting their lives and their health back. There's a lot of stories where people get their lives and their health back, and it just takes but it is going to take some effort on your part. They're going to have to get in there and get that integrative team involved. So, and I'm happy to help point people in the right direction, have those conversations. But thank you for offering hope and help out there, and those stories of and those anecdotes of patients getting their lives back is I find very helpful. I mean, that it can be done. It can be done.
As I said, like I think there's always hope with anything, and like again, like the cyclist, he kind of had knew what he was dealing with, and he just says, I'm not gonna wait. I'm just gonna attack this and go for it. And
Excellent.
I think there's something to that whenever you can.
I'm I'm I believe in moving forward and attacking attack that problem. So the I think that's appropriate. Get after it, and it you can get your health, you can get your life and your health back.
Mhm.
And I'm glad that we're sharing these stories and the ability uh, for people to be able to do that. So get started with your integrative team early, as early as possible, and then that way you can be monitored and get appropriate protocols set up, including nutrition, exercise, things of this nature. Excellent.
Sounds good to me.
I'm looking forward to our next conversation. Thank you, sir. Doctor, you have a great day.
Yeah, you too now. Take
Yes, sir.
care.
Bye-bye. I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.